As we embark another brand new show for the year in the month of March, welcome to NESHA Medical Talk. So this is a program where we get to feed you with free consultation, joined by the medical expert himself. That's none other than Dr. Nelson Makemba. Welcome.
Yeah, thank you, and I'm excited to be here. We are looking forward to another exciting, conversation.
Yes, we are.
I just try to make sure that our people are kept informed.
Yeah. Thank you so much, Doc. We always appreciate. For those first-time viewers, where is NESHA located at?
For those that may want to use our services, we are located in Windhoek North, in Oyefa Street, address 209, just across from Central Hospital main entrance. And our contact detail is 061, that's 220 061 220 or they can actually visit our website, which is www.neshamedical.com, and all the details will be provided on that site.
And on all the socials. So if you haven't subscribed, please subscribe to our YouTube channel and share it to those that are in need. So for this discussion, it's all about mental health in primary care. Why is this such an important topic, Doc?
It's very important for us to talk about mental health in primary care because this is where it's an entry level for most of the patients. This is the platform where they get to be seen for the first time. And obviously because of a lot of stigmas and that are associated with mental health related issues, cultural dynamics that are at play. So when we address it, and give it the proper attention it deserves, sometimes it improves patients' outcome.
And speaking about stigma and culture, let's start there. Is there, and how much does that actually stop us from either diagnosing, recognizing, and also having such open conversations about that?
The cultural dynamics that play out when it comes to mental health related issues are such that, oftentimes it's of discriminatory nature. Patients are being stigmatized and labeled. Then what that does to a patient, the patient develops fear, and then delayed health seeking, behavior where they are not going to see the doctors and getting help on time. And when that happens, you get a poor outcome because by the time they present is often very late. And they're in a gross florid state, maybe that might take a lot of time to nurse them back to a mental state where they're able to be functional. So for one to try and overcome this isolation and discrimination that comes with it, we got to be open, we got to offer a safe space, non-judgmental space for our patients to come in where they are not feeling judged, so that they're able to actually, break down and then just, cooperate with the health service provider in order for them to get the best care that they can get.
As a GP, you are the entry point. You get to screen, you get to have the conversations, and when you diagnose, that's where you recommend. But what is the process like? How does one get diagnosed? What are some of those screening step one basics? And what are some of the, let's say, engagements that you have with the patient to say, look, maybe perhaps, you are going through some mental issues?
The first basic thing that one probably need to look at is just we call it bedside etiquette in the medical fraternity, where a patient would come into a consulting room or in a clinic. You sit them down, especially with mental health related problems, you need enough time. You take a proper history, finding out, what the symptoms are when they started, are they becoming severe in nature? Finding out a family history, do they have other family members that seemingly display similar symptoms? And then do a proper physical examination of the patient, first and foremost, to rule out what we call an organic cause. And then once you realize there's no organic issue, then you probably then focus mainly on the health-related problem. You have, psychological evaluation tools that we can use as you're taking your history. We have also the DSM-4/5 and ICD-10 type of, structured criteria that we follow then in evaluating the patient. Depending on their presentation, then we're able to sort of give them an appropriate diagnosis to tell them whether it's a depression, it's an anxiety. And when that has been established, then we have to now institute, sort of evidence-based therapy. The medical fraternity has moved on from what we used to have a blanket approach to a lot of things, where we say, okay, depressed individual probably get antidepressants, anxious people get anxiolytics. but we're trying to become more tailor-made, and we sort of have a specific tailor-made, approach to every individual, evidence-based. So you treat the person in question in front of you after you have gathered all the necessary information from history and evaluation, and then you give the drug that is most appropriate to take care of the problem, or you even refer them appropriately either to a psychiatrist or a psychologist to get further assistance. Yeah.
So for the health professionals, opening up is not easy.
Yeah.
Especially with stigma.
Yeah.
What would people think of me
Yeah.
if I'm, diagnosed with depression? It's like, there's something wrong with me.
Yeah.
So for those in the health profession, how does one create safe environments to speak about it? And how does one support? It's not easy to say that, yes, you were diagnosed, instead of now taking medicines, but how do you create and foster that safe space?
What we do what we call continuous medical training, where we get to attend seminars, get ourselves informed, because the medical field is also a dynamic field. It's not static. It doesn't stay the same. So things change, approach change. So we attend courses where you're able to learn what is new, what is cutting edge. And then once you have equipped yourself with that, you're able to foster an environment that is safe for your patient, a non-judgmental environment. You're able to harness the resources and refer patients appropriately. And when you do that, you then become, of better service to your patient. So continuous medical training is something that we advocate for, especially with the primary health care givers, because things seemingly are changing all the time. So the approach to depression that I was taught when I was in medical school over 15 years plus years ago changed.
Yeah.
So if I don't get to learn what is now happening, in 2025, I might not be able to deliver adequate services. So that's why we have a system in place that actually compels us to sort of, go and, learn new stuff. And then we're able to be of good service to our patients.
Yeah. Not only just those, providing the support from a medical point of view, but family members, friends, environments, people, places. How can not only you, doctor, as a GP, but the whole society to educate the public, not only just with mental awareness months, but throughout and consistently? What's that role, and how can we as a community be more involved to help those that are going through a dark time mentally?
Yeah, it's actually, and especially when it comes to mental health related problems, oftentimes we do rely on what we call collateral history. Let's say if somebody is really grossly, psychotic, if I may use that word, for the sake of the conversation, comes into a space where they need help, but they are not in a mental space to even render history to you. So oftentimes you'll find family members will be the one bringing them. And then you have to sit down with the family member, get the history from them. So for us really is to engage families as well, give them the adequate information so that even when they go back with their loved one home, they're able to better care for them. Platforms like this where we have this type of talks on NESHA talks, people can, sort of tune in and learn a thing or two. Engaging the public either on social media platforms, print media, television, places of gathering such as, community gathering, churches, and also the move has been to also incorporate some of these kind of subjects in our curriculums.
Yeah.
And sort of teach it to our children in school at a very basic level. When they go home, they're able to talk about this to their parents, and then it sort of stimulates, the whole family environment, and then everybody get intrigued to wanting to know about, what happens in this space. And then when that happens, everybody's informed, and then we're able to better care for our loved ones.
Yeah.
Yeah.
Well, Doc, we thank you for also starting these conversations. As we wrap up, any final remarks?
Yeah, all I want to say really basically to those that are engaging us and that will be watching us is that if you do find yourself in a space where either you yourself are having some challenges when it comes to mental health related issues, or a family member or a loved one, the idea is to always be empathetic, active, supportive, have that listening ear, be non-judgmental in your approach, And it's probably best to make sure that you seek health intervention. I know culturally people believes all kind of stuffs, especially in our African setting. You might find people might take their loved one to a traditional healer, for instance. We don't always want to shut down people's cultural beliefs, but the best place, the safest place is to engage healthcare providers, because they might just provide the solution that you are looking.
Very well said. Doc, thank you so much. We appreciate. And we'll be back next month.
Yeah, thank you very much for having me, and I look forward to more exciting conversations.
You're welcome. So there you have it. NESHA Talks right here on the YouTube channel. And if you know of someone that actually needs to hear this conversation, share the link, subscribe, and let's just have a conversation at a time. We will be back next episode.